everyone, thanks for joining. We're going to get started now. Just a reminder, 30 minutes, one question, one follow-up. Today we have Dr. Williams and Dr. Yaffe here, so I'll turn it over to them for some brief remarks.
Yes, good afternoon. It's Monday, so a lot of things happening, a lot of things on the move, and to update you on of areas of concern and issues we want to focus on. So I'm going to first give things over to Dr. Yaffe because we want to see what happened over the weekend, where are we at in this third wave, how are we doing, and what we need to address. So over to you, Dr. Yaffe.
Thanks very much, and good afternoon, everyone. Since our last update on Thursday, Ontario is reporting an additional 9,164 cases of COVID-19. That breaks down to 2,169 cases on Friday, 2,453 on Saturday, 2,448 on Sunday, and today 2,094 cases. Our 7-day average for daily cases is around 2,094, and that's up from 1,600 last week. 1,350 2 weeks ago, and 1,155 at the beginning of March. We're also reporting an additional 57 deaths, unfortunately, since our last update on Thursday, and that includes 10 deaths today. Today we have 841 people in hospital with COVID-19, and that's up from 813 last Monday. The number of people in ICU today is 382, and that is up from 298 a week ago. With respect to testing, we're reporting 39,470 tests that have been completed, with a percent positivity of 6.1%. This is the first time since January 19th that the percent positivity is above 6%. The average percent positivity over the last 7 days is 4.6%, which is up from 3.9% the same time period last week. In terms of variants, today we're reporting a total of 1,894 confirmed variants of concern in Ontario. Of those, 1,749 are the B117 variant, originally identified in the UK. 63 are the B1351 variant, originally identified in South Africa. And 82 are the P1 variant, originally identified in Brazil. The weekly percent positivity for cases tested for mutations or for variants of concern today is 57.4%. That's up from 48.7% a week ago. The latest effective reproduction number for the variants of concern is 1.31, as compared to 1.10 for non-variants of concern. Today being Monday means that some of our health units have moved to different levels within the province's color-coded framework. This includes Hamilton Public Health, which is now in the gray lockdown level, and Eastern Ontario Health Unit, which is now in the red control level. These regions are in addition to Temiskaming Health Unit, which quickly moved into the red control level last Friday. These decisions were all made in consultation with the local medical officers of health and are based on the trends in public health indicators and local context and conditions. We have also just finalized the decision to move Middlesex London Health Unit into the red control level effective 12:01 a.m. Tuesday. Based on the current situation in the area, it was decided in consultation with the local medical officer of health that stronger public health measures were urgently needed to help ensure the continued health and safety of people in that region. And now I would like to turn it back over to Dr. Williams for some additional comments.
Well, thank you, Dr. Yaffe. And you can see the numbers and the changes are concerning as we move into the third wave. As the modeling had predicted, we would be seeing this transition in the end of March, more and peaking sometime in the first week of April. So we are in this time zone right now. And we have seen the number of variants of concern move over the 50% mark up to just close to 60%. And so they have become the dominant, the three of them and their composite have become. Most of them, as Dr. Yaffe has alluded to, are the B117 or the UK variant. So with that, what are we doing? You can see that when Dr. Yaffe talked about the number of health units that are moving within the framework, instead of just once on Monday, you heard about some there last week, some are Friday, and some are Monday, and another one today. As we move much more rapidly to change health units, moving up in the framework. And with that kind of rapid approach, because then we are trying to adapt and move more quickly to try and curtail the spread of these cases, especially the variants of concern. And we have others that we're looking at and concerned right now as we monitor this data on a daily basis. So the thing is that we didn't mention that is that some of our ones that were in the lockdown, the highest one before in the past, Thunder Bay, has moved down considerably now and just above about 108 cases per 100,000. So they've done a really good job of bringing things under control, and we commend them for that action and activity and the community at large in the district. As well as we're hoping that things in Lambton as well as Sudbury seem to look like they're plateauing, but still early to say it at this time. So those lockdown measures thus far are proven to be effective in that approach. At the same time, we're trying to look at what we can do to encourage safe and healthy behaviors, and our science table has come back with, as long as our public health measures table, to encourage more outdoor activities. Of course, safe outdoor activities with proper distancing, masking, and those who are ill should not be involved in those, should be staying home or getting tested or assessed at an assessment center. We're also looking at how we might try to look at some of our ones that have personal care settings have said they put in place a lot of measures to protect individuals in there. This is not without cost and without a lot of effort, and they are concerned about their safety of their staff as well. But some people have been in lockdown for a while. What was seen as maybe a nicety moved to a necessity, and now some feel the urgent need to have that dealt with. So we're looking at that perhaps around the week of April 12th, but that depends on how the data progresses, and we can change and amend that if we have to. So we are trying to look at how to make sure people can get, if they feel what they need, essential services, and those that be moved into more essential with care and caution, with checks and balances in place. Because the key, again, is personally how you handle it, how you're doing your masking, your distancing, and when you're in close contact with people, you maintain your mask on, you keep your period of contact to a minimal, and you do not move into congregate settings unless you're with household members in that. We are still looking at how we will go use the emergency brake if and when necessary to move even more quickly to bring things under control in our various 34 health units within the province of Ontario. So we have called the so-called emergency brake would be called more of a shutdown rather than a lockdown, and that would then even limit some of the things we've opened up on the lockdown zone at the moment that you've heard about in Toronto and Peel, to be even more tighter restrictions if necessary in that type of emergency brake and sudden and increased at any level really, not just from the progression up at that time. So we're moving in that way. We're trying to move continuously on the vaccinations to get them out and around. A number of the health units have moved to reduce their booking systems down to 70 plus. And we applaud them for that, as our percent coverage in the over 80s has moved above 80%. And we still want to make further headway on that group there, as well as now on our 75 to 80s, and then now the 70 to 75-year-olds as well. So we're continuing to look at that, as well as other priority populations as we strive to get through phase one seeking in the first early part of April, dealing with, of course, our ongoing issues around vaccine supplies and delivery, and moving out into our various venues, including expanding the list of pharmacies, a number of mass vaccination clinics, as well as other ones for mobile activities, dealing with various high-risk populations and various settings. So a lot is going on in that regard, and we continue to watch it. And that's where we're at in this time of this third wave, trying to have everybody stay the course for the next 6 to 8 weeks. This is what's critical to deal with our vaccine rollout. We're seeing some shifts in, of course, we've had great success in our long-term care homes and our retirement homes, bringing down. We've seen none of them have had no deaths in this past week. That is really great news and shows the effectiveness of the vaccine. We continue to roll that out as quickly as we can. But we've also seen a shift in our hospitalizations. We've seen that number go back up again. Some of our data shows we're getting close to where we were in the peak of our second wave. So we're finding it's a younger population. As our modeling table has shown us, the risk of getting hospitalized with the variants is higher than with the initial COVID-19 strain, almost 40% higher. ICU admission for those ones that tend to come in younger, even in more acute conditions, going straight into ICU is almost twice as high as with the regular COVID. And the rate of death, unfortunately, is also about in the range of 40% higher. So this is not a benign issue with these variants for people under the 50 who felt that maybe in the initial COVID it wasn't a big deal. This for you now is a big deal. And even down younger age groups have to take real precautions during this time to limit the spread because it moves very quickly, very rapidly among people. When you have a break in your precautions, in your IPAC principles, your masking, your distancing, hand hygiene, and those other activities, to keep with your congregate only in your household. These are not just sort of casual comments. These are really necessary and critical at this time if we're going to try and bend this third wave at all and keep it under control. Because we have three components in it. We have three variants moving, not just one. And we have a number of other actions that are happening at the same time. So stay focused, stay at the task. The light at the end of the tunnel is coming. We see the vaccines are working. We're trying to get as much vaccine as soon as we can and to get it out in a very consistent and documented way through our COVAX systems to make sure we know who got it, when you got it, and when you're going to get your second dose. So all this is being run with a lot of energy, a lot of work by a lot of people from all sectors, including our public health units, our paramedics, our primary care physicians who are assisting in that, as well as other sectors and volunteers, plenty of volunteers. We thank you for your work and your devotion and energy in this, and we applaud you for taking part, and for the people who are bringing those to the clinics to get seen. Some may have transportation issues, and to be patient as you book through the system. It's working well, but there are challenges, and some people have challenges with electronics. Those who want to help them do that, help them get booked, help them to guide themselves through it. There's phone lines as well. So there's many ways we're trying to make it as amenable as possible and to work on that. So stay focused, stay consistent, stay vigilant, do what you need to do, wait for your vaccine, and with that, we will, I really feel we can bring this under control, but we need time to do that. Therefore, the public health measures still have to be moved on, sometimes very quickly, as we've done with Middlesex London, and we'll do with others if we need to do so to try and curtail the action of these variants of concern. So with that, I'm going to hand things over to the media for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
From Christina Tanalia at CP24. Please go ahead.
Hi, Dr. Williams. Hi, Dr. Yaffe. I want to ask you about the AstraZeneca vaccine and NACI recommending that it be suspended for those under 55. So obviously the vaccine has not been administered to those that young yet here in the province. What does that mean for the province of Ontario? Do you suspend it for that age group? Do you suspend it eventually for everyone? What are your concerns? And what is this? Does this mean anything for anyone who is, of course, in the age groups, 70 plus, who has received their first dose? Or sorry, I should say 60 to 64, I believe.
Great. Well, thank you. Yeah, there's materials there that we have been, I know I was working all weekend on. Our Chief Medical Officer of Health meetings across Canada. We had scientific updates from Centers of Excellence. And in Ontario, we have one of those right here in Ontario. It's one of the world leading centers that deals with this very rare and unique type of situation. And I will emphasize it is a rare one. It still is a rare one. And we're trying to understand background rates and how it's effective. It's the same as that they were looking at in Europe before, and that they had changed, and some countries had gone back to utilizing in all age groups the AstraZeneca vaccine. Some had been more limited to saying not for people under the age of 55. We wanted to make sure that we had been advised with the best scientific information, and with a Center of Excellence here in Ontario, we utilized that, including with their counterparts in Europe, and that was very informative. At the same time, we were wanting to gain further data and information on this from, especially from the UK, which is one of the largest users of it, and they're meeting with our officials sometimes a bit last night and today, and we hope to be appraised on that. We have said we're pausing on the use at this time for those under 55 because while there is a very rare incident, we want to make sure we're fully appraised on this in that. And because if we're going to give people advice, we'd like to give them the best advice we can give them on this matter, so they're as informed as we are. And our information so far is that the vaccine, the benefits of having it to prevent COVID, especially now with these variants of concern, and people and young people, far outweighs the risks of this rare one. But we want to know, what is that? How clear on that? So we want to be clear that our experts know. Our science committee has already put some information out in that regard, and we want to make sure that we are well equipped to advise any Ontarian who is wanting to get vaccinated. And as you know, aware of the issue, Minister Elliott was vaccinated earlier today with the AstraZeneca vaccine, and she was fully confident in its safety in her age group, etc. And so we are consistent with the CMOHs. We're putting out a statement. We haven't seen the final one draft yet, that we had a consensus that we would go along with NACI and have a pause at the moment. We want a few days to get the data we need to do to advise on that. Of course, in Ontario, we haven't, our guidance hasn't been out to use under the age of 60. We don't have the volume, and Canada writ large hasn't had anywhere near the volume of the vaccine as the UK has, so we're looking for their experience and knowledge, which has millions of doses used, and we're waiting for their evaluation, as well as an update from the European Association with their Pharmacovigilance Committee that was meeting to go over data there. So we want the most up-to-date data on this as we proceed. So we have no concerns with those who have received it so far on that basis there. If you have questions, you can talk to your family physician and primary care person, but for most of them, it's a fairly rare new thing, and they would probably want to know, what does it mean? And so we're trying to get scientific information out through our science table so that our healthcare community, specialists and otherwise, would be as up-to-date as they need to be to understand it, to be able to translate this to their patients and clients who may have questions, because if there is some issues, you want to make sure that you want to be assessed and you can evaluate that yourself. So right now we haven't got a lot of the AstraZeneca. Ours is not from the European and UK. Ours is from the Covishield thus far, from India, from the Serum Institute of India. And if we're going to receive some, it would be from the US. In the next while, we're waiting to see if we're going to receive a shipment. So we still want as many people protected as quickly as possible, and to try and drive those numbers down. And we still have a lot of work to do to get from 60 up to 75 to 80 done. We still have a lot of people to move through, and so we're hoping to be able to access that vaccine and to utilize it as best as quickly as we can, because there's lots of people waiting. And as I said, most of it we have used up pretty well all of it, and we're waiting for more. So before we get down to that younger age group, we've got a lot of people to deal with even now. So we have our work cut out for us.
Follow up?
Thank you, Dr. Williams, for that thorough answer. I wanted to ask you quickly about March break. A lot of questions about that from from parents. I recognize the comments from Education Minister Stephen Lecce on this today, or sorry, I should call it April break. But considering Dr. Yaffe just noted, we have not had a positivity rate above 6% since January the 19th. Where are you now in recommending that there be a deferral of the April break, or perhaps even instead, are you considering that the year end a week earlier as opposed to an April break? Where is your recommendation at this time? And I realize things change quickly, and this depends on the numbers as we inch closer to the April break.
So, again, it's in this time of volatility and watching it, as we've seen the numbers go up quickly. We are trying to see if we can bend the curve at all. The April break, as you allude to, is still 2 or 3 weeks off. As we've noted today, things can change pretty quickly on the upswing. We've seen some places come back down again as we put down some limitations there. So we're going to be really looking at it closely to make some assessments. In our committee that looks after this, our so-called Education and Public Health Committee, that it has both Minister of Education as well as local board representatives and public health people on it, are going to review the data and looking at it. So our assessments thus far of students coming in with one symptom has been very effective of picking up a lot of students before they even get into school. A lot of our outbreaks are small numbers of students, mostly related sometimes to some staffing limitations who may be on quarantine with potential exposure, so therefore it becomes more of an administrative issue. So far our schools have not shown widespread outbreaks. Nevertheless, our public health officials will be quick to close schools where there is some concern about ongoing transmission in the schools, especially as we look for our variants of concern, as we see students who are coming with one symptom and we identify them at the door before they get into school. So the answer is, we're going to be watching this carefully. We'll be making some recommendations in consultation with the Ministry of Education, in consultation with our minister and with Minister Lecce and that. But right now, our evidence shows us that we are doing a good job of keeping it at bay. It is becoming more and more challenging. There's more community spread. And that's our message, because sometimes you may say, well, why bother and that kind of stuff. You need to bother, because what you're seeing, it's having an impact on our hospital system again. That means people under the age of 50. We're not talking about the elderly now. And we're talking about impacting our schools and having to close the schools. So these things that we said were so important to keep open, we would like you to really be vigilant over the next few weeks to keep those variants of concern under control, because they are controllable. You can bring them down if you personally do what you need to do all the time, every time, and keep that at bay. And we can keep our schools open and keep our numbers and hospital admissions down. But we are in that precarious time right now, so we will be watching and monitoring. And if we need to, we'll make some statements and issues on there. But so far, even our surveys of whole schools that have had cases, when we come back and test all the students in the school, our rates of positivity are less than 1%. That certainly is reassuring. But we need to be very strict on our limitations there and how much testing, and to make sure everyone who has symptoms, even mild ones, is tested before they go back into the school system.
Next question.
From Colin DeMello at CTV News. Please go ahead.
Hey, good afternoon, Dr. Williams. We're hearing a lot of instances where people are hesitant currently to receive the AstraZeneca vaccine. The province says it's safe for people 60 plus who can get the vaccine. I'm wondering, what are you basing that recommendation on, that it's safe for people 60 plus? Is it strictly based on NACI, because that group's recommendations have been constantly shifting, or is the province doing its own research on the AstraZeneca vaccine?
The information that we have received, it's not on the basis, NACI is going to make a statement on it, that's true. Our information was based on the early studies of these very few small cases that we have seen from the European sector, and these have been in individuals under the age of 55. They have not seen it in over the age or an increased rate over 55, but we would like to see what is the UK seen. and the things that evidence that there because they have much wider population vaccination. So we want to see what those numbers are there. So we're basing on what we've heard from our Center of Excellence and from our European sector to see what they're saying. So far, the ones they've identified of concern have been under the age of 55 in that. And the ones they have so far, the very small number, have tended to be more females under the age of 55. But we want to say, is that really true? Is it just what they've picked up at this time? And even the center experts say the number is so small, they're not really sure. But this is why we're doing this. When we do these vaccines, and that's why we have our ongoing adverse event reporting, we work it globally. This is more robust than we've ever seen before. This has moved much faster than we've ever seen before. And it may seem in some people's mind overly cautious. But that's fine. We don't mind being overly cautious. We don't mind pausing for a moment to make sure, because we want to be sure that when we do roll and have it out, that it is safe and safe to use in that area there. And so this is being, I'd say, more cautious than I've seen in the past, but that's okay because we have evidence and material and we want to be advised on that. So NACI has reviewed it as well, but we've done our own review and looked at it from a perspective of the Chief Medical Officer of Health of Canada, as well as from Health Canada and other regulators. And we're wanting to pause until we have all the information on the table so we can inform our public of where we can use it and not use it, and if we have any concerns on a go-forward basis. Because certainly it has proven itself to be effective, and we've seen that from UK, but we want to hear from them. They're our main source of information, and we hope to get a report from them today or tonight.
Follow up?
Thank you. When it comes to ICU data, your numbers say there are 382 patients in ICU, but Critical Care Ontario says that number is actually 409. There's an obvious discrepancy there. I'm wondering which set of numbers are you using to make decisions on what to do with the third wave?
So they're all moving. I use the CCSO one myself. That's the 409 in there because I want to see how it's progressing. And as you've alluded to, or you may have alluded to, that 409 is not that far below what we peaked in the second wave. We do have some more beds now with the Cartolucci Hospital opening, but that's not much solace as our centers are dealing with these cases, and some of these ones are coming in much more critical and have a longer stay in the ICU. So this is challenging the system very much so. So whatever one you use, it's not the actual, it's how it's moving through it, because it has a comparison in there. It's impacting our system. Some ICUs are totally full with VOC patients, and some are younger, and some are not full, but they're getting transfers. So the system is trying to respond to handle that load in there. The idea we're trying to say is, well, not the idea, what we're pushing hard is that by doing what you need to do, you won't get in the hospital, you won't get in the ICU, and not anything. We don't want to see you in the hospital. We don't want to see you in the ICU. So do everything you can do to stay out of there. And that means these recommendations are not just loose talk. These have real life implications. And we're finding younger people without comorbidities getting in pretty severe state fairly fast and going into the system. So be careful and be very vigilant in your steps and processes, because you can protect yourself if you do what you're supposed to do all the time.
Last question.
From Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Doctor. Just to follow up on the numbers and the vaccines, there seems to be more of a push on, including John Tory today mentioning that the GTA would like to get a lot more vaccines because it's a hot spot. Do you see any need to pull vaccines out of some areas where COVID is not so bad and bring it to areas where it is bad?
Well, we have demands for vaccine everywhere. And I know that our team, our task force, are doing a real balancing act to move it around to hit with priority areas. We have some identified in the midst of large outbreaks that would like to look at high-risk sectors within their jurisdictions. So we're trying to be as nimble and quick as we can to move around to areas of priority. I like to be getting 1 million a week, more than 1 million a week. I think we could handle it. We could deal with 2 million a week and do it. It's just how do we get it? And we're really trying to drive hard there. So The GTA wants more. We're trying to address that. We have other areas there. We want to make sure if anyone's got stuff sitting in fridges, we want it in arms. So we want to use up everything we got. So we're trying to move that around, of course, without compromising the cold chain maintenance of those vaccines. We don't want to lose vaccines. So we can move it around, but we can't be too casual because we'd hate to waste vaccine. We don't want to waste vaccine. So we're trying to be as nimble and as resilient and quick as we can to respond, and with sometimes the variable delivery dates of some of the different vaccines that, due to different things, get delayed by a day or two. So we have to be as I guess, quick and responsive as we can in that.
Follow up, and this is the last question.
Thank you for that, Doctor. And just on the Friday announcement of the emergency break changing to let you consult with a local medical officer and actually put a region back into a full shutdown. So I know there's not always hard and fast criteria for changes. It's a mix of things, but you did say earlier that you're watching a number of health units. So are you looking at any health units now for going back into lockdown, and which ones might they be, so that people might know that they need to double down on their precautions?
Well, I mean, we're looking at the data. We get it updated. We're going to be looking at it again tonight. And to assess that, we're talking already with some MOHs. And to be clear, we'll be making recommendations if we have to the cabinet. And the cabinet has been very open to being much more able to move fast on ones if they need to. So the old cycle of talk about it on Wednesday and pass it on Friday and announce on Monday, that we will do that sometimes, but we've seen as this past week decisions made to go on Thursday and then on Friday and then another one today. So the cabinet is very open to hearing updates very rapidly, and they're asking us about situations too. So the cabinet ministers and the premier are as concerned as we are, and so we're trying to update them as fast as we can with updates and discussing with the local medical officer of health, because it's not just the one number, it's a number of things that are happening. And if you're applying the emergency brake, you may have to do it even in a green or yellow zone. If all of a sudden, in a few days, your numbers are doubling and tripling and your VOCs are going up very fast and you got outbreaks, you can't say, well, it's just a day and go to the yellow and go to the orange. You can't do that. And so we may have to be very expeditious in our movement in there. And so what seems to be okay today, we may have to move fast on in a few days. But we'll try and give everyone as much advance notice as we can, but we can't give too much if we have to move very rapidly up in a process.
Thanks, everyone.